Hello, everybody. Good afternoon. If you've joined us before, welcome back. We thought today's topic of child hunger was of sufficient importance and interest that we actually really invited many more people to this than we usually do. And we're really glad to sort of see so many of you on this call today. It's a really relevant and important topic. And one of the reasons we're discussing hunger, childhood hunger today, is because we are moving from summer into September, which is of course traditionally back to school time. And September is also known nationally as Hunger Action Month. It's a month-long, obviously, initiative to really keep awareness of food security high in the national consciousness. And we at Philabundance try to do that through media alerts and various activities throughout the month. But this year, especially, during this time of really increased need caused by the pandemic and the decline in food and financial donations and the higher awareness of food access as months have gone on and on and on, we are doing our best to try and keep the issue of food insecurity and childhood hunger in particular in the forefront on the national agenda. So we're really, I wouldn't say happy, but really pleased to be producing this town hall today. Of course, we are not going back to school in the same way in September. And this is really going to affect the 130,000 school children in Philadelphia alone that receive free and/or subsidized breakfast and lunch throughout the school district. How are they going to eat without these meals? What is our role as Philabundance, driving hunger from our communities? What is our role in making sure that these families are able to, and their children are able to procure and provide healthy food for their families? And that's really the discussion we're going to have today. And we have some great speakers, so I'm going to move along and introduce them to you. We are, of course, Lori D. Jones, our chief executive, is joining us. And before joining Philabundance on June 2nd of this year, Lori was the chief of staff at Rutgers University Camden, and she served in a variety of leadership positions in nonprofit organizations, education, and city government throughout her career, including roles with the School District of Philadelphia and as the managing director for the city of Philadelphia. She does an awful lot of things, but among those, she serves on multiple boards of directors, including Health Partners Plans, the Philadelphia Health Partnership, the Pennsylvania Horticultural Society, and the Independence Foundation. Also from Philabundance today is Hillary Siebel, who is our agency programs manager. And Hillary joined Philabundance in 2011 in order to address our programs that look at child hunger. She has launched and scaled child-specific program models through a range of strategic partnerships and collaborations. In addition to her leadership of child hunger alleviation efforts, she also oversees our senior box and our produce programs. And Hillary has served as a capacity advisor for childhood hunger on a Feeding America board, and she also sits on the Hunger Free Pennsylvania board. Kim Parker is the Senior Director of Preferred Meals, which has been a great partner of Philabundance. She oversees the accounts for the School District of Philadelphia and the Departments of Parks and Recreation, as well as the overall Southeast region. She's a graduate of Fairleigh Dickinson, and she has a BS in Business Marketing. She has more than 20 years of food service experience, largely with Aramark in the Sports and Entertainment Division, and extensive experience in sales, operations, customer service, and financial forecasting in the food and beverage and event planning industry. Lauren Nocito is the Director of Nutrition Education and Eat Right Philly SNAP Ed for the School District of Philadelphia's Office of Curriculum and Instruction. She oversees and coordinates the Eat Right Philly program, which provides both nutrition education to students and families, as well as training and technical assistance to school staff around healthy school environments that support the district's wellness policy. Lauren previously worked for Health Promotion Council, an affiliate of the Public Health Management Corporation, as their Director of Nutrition and Wellness. She has more than 15 years of experience in community nutrition and public health work. Lauren is a registered dietitian and attended LaSalle for her undergrad and Drexel University for her master's degree. And finally, Erin Cassar is a senior research associate for the School District of Philadelphia in the Office of Research and Evaluation. She is the lead evaluator for this district's SNAP Ed funded work. She also oversees the administration of the Youth Risk Behavior Survey for Philadelphia. She's a former New York City public school teacher and earned her PhD in urban education from Temple. So before we get into really the meat of the discussion, I'm going to hand things over to Lori Jones, who will provide an overview of the work we've been doing recently around COVID.
Thank you, Sara. Thank you to all of our panelists, and thank you to all of you for participating in this Zoom town hall today. It's great to have donors and supporters who want to remain informed of this work. So I'll provide a quick overview of what's been happening related to COVID and just generally the ways we've been responding to need across the Delaware Valley. You see a slide up about tropical storm Isaias. And one of the things that we were able to do, those of you remember those pictures that you see in the bottom right side, that a neighborhood not that far from here in southwestern Philadelphia, Eastwick, was flooded. And as a result, people lost electricity. So the councilman there, Councilman Kenyatta Johnson, reached out to us and asked us if we would do an emergency food distribution. So more than 300 families showed up, and we were able to give each of them 50 pounds of food. And the city was also able to provide them with cleaning supplies, bleach, and the like. And so our ability to respond rapidly was something that we're very proud of and something we want to continue to do to meet folks' needs. Move to the next slide, please. You know that there's been an increased need for food, up to 60% across our region and also across the country. You also know that there have been challenges with food supply. You actually can go back and look at an earlier town hall on that issue. One of the ways we've been able to meet the need, the increased need, is by participating in the USDA's Farmers to Families Food Box Program. That's also supported by CFAP, the Coronavirus Food Assistance Program. And so we were able to distribute more than 8 million pounds of food throughout the region. This program is set to end in mid-October. We are hoping that the USDA will continue it. We also, though, are looking at other government sources, notably TFAP, to see if we can continue to get increased produce, particularly to families across the region. You know, if you know Philabundance, you know we don't do this work alone. In fact, one of our core values is collaboration. We can't do it alone. We do this work through working with more than 350 agency partners across the region. And during this time in responding to COVID, we've increased the number of deliveries, and really the agencies have made themselves available at additional times, additional hours, provided deliveries where they used to have people come in. We've supported them in a number of ways. We've provided PPE, provided masks to them, provided other cleaning supplies, provided them with refrigerated trucks and refrigerated vans as well. So we try to support the agencies by providing as much capacity and infrastructure support as we can, and that definitely has increased during COVID. Another thing that you're seeing, not just here, but across the region, is more folks ensuring that people who have need for food have access to safe, healthy meals. We've started a few new initiatives. One of them, we're initiating a 7-week pilot with US Foods with one of our main partners, Caring for Foods. So we're anticipating being able to produce 20,000 frozen meals to get to folks in need. These will primarily be distributed to seniors and other people who are homebound. It's no surprise that we had to suspend food drives, and a big part of how we get food to distribute to families in need is by the generosity of folks donating food that we can then ensure that our agencies have to get out to people. We've transitioned from doing actual food drives to doing virtual food drives. And really because of the generosity of many people on this call, as well as people across the region, we were able to dramatically increase the amount of funds that we brought in. So we were able to take in more than nearly $300,000 more than we did the prior year. Now, as great as that is, one of the other things that's really wonderful is now that we're starting to figure out how to put safety measures in place, we are going to reinstitute food drives. And so you can look out to media outlets. You can check our website for information about how you can, again, start donating food, primarily at our Berks warehouse. And then finally, those of you who are longtime supporters of Philabundance know that the end of the year, October to December, when so many people are particularly generous, is what we call here excitement season. That's a time when there are very many public food drives. There are fundraising campaigns. A lot of third parties do events to ensure that we have the food and the funding we need going into the next year. We're not quite sure what that's going to look like in 2020 in the era of COVID, but we are gearing up for that. Historically, 50% of our annual revenue is earned just during that period of time, during that one quarter. And so our team is working with partners across the region to ensure that we're able to get the resources we need to continue to support the families in the coming year. So that concludes my update of what's happening with COVID-19. I will be available to answer questions toward the end of this as well, but I will ask Hillary now to kick off today's conversation about something critically important and near and dear to my heart, childhood food insecurity.
Thanks so much, Lori. I'm happy to be here to speak with you all, and thank you all for being here to talk about and learn about the issue of childhood hunger, also near and dear to my heart. So in 2018, the Feeding America Map the Meal Gap study showed us that 1 in 6 children in the US was food insecure. Now, since COVID, we're moving towards 18 million kids facing hunger, giving us a national average of 1 in 4 children projected to be food insecure this year in 2020. We know that hunger affects every part of a child's well-being, including their ability to focus and how they behave, how they work in schools, and how this translates to their home environments and other behaviors. Can go to the next slide. The projected increases for child food insecurity from 2018 to 2020 are just absolutely staggering. In parts of our service area, as you can see here, the need has increased nearly 100% and has more than doubled in most of our service counties. In Philadelphia, over 30% of our children are facing food insecurity, up from 22% just 2 years ago. One of the ways in which we address child food insecurity is through our backpack program. Our backpack program traditionally operates through strategic partnerships with the schools, libraries, and different after-school programs held at agencies. Pre-COVID, the program was available at select schools that were participating in really high-need areas through these well-established partnerships and processes that we had in place to distribute the food. And then come mid-March, when COVID hit, we kind of had to stop in our tracks and evaluate what was happening, and we weren't able to distribute at schools from that time forward. We work with a network of site coordinators at these schools and a team of nutrition educators who help to implement the program. They help to track participation and also provide recipe ideas and instruction to students and parents. And once COVID hit and our schools shut down, so did our operating process. So we made some quick shifts and modifications to still get the food out through our agency network. And then we took a pause to think long and hard about how to plan for this upcoming school year with so many unknowns. This year, with schools being closed and our best practices in mind, we're shifting the program to our agencies to equitably provide the most reliable and consistent service. We will still work with our schools and partners to connect students and their families to our local pantries. And then our hope that this shift will also allow greater consistency, greater equity, and greater connection to the neighborhood pantries we serve. And it'll serve as a greater resource for the children and their families. As seen on a previous slide, I think it said the backpack contains 4 meals, a total of 24 servings, and it comes at a cost of about $5 per pack. And our funders provide just under $400,000 a year or so that we can distribute over 300,000 meals, which is, or 1,000 pounds of food, which is roughly just under 2 million meals per year. If there's a next slide.
Now I'd like to introduce Kim Parker with Preferred Meals, one of our Philabundance's supporters of the backpack program, to kind of give an understanding of why this program is so important and why she's supporting.
Kim, you're still muted. Can you unmute yourself, please?
There we go. Thank you for introduction. So again, I'm with Preferred Meals, which is a K-12 Elier brand. And our goal is to make sure, because we realize that every child deserves a great meal. So when our schools closed, our teams had to devise ways to get the students fed that rely on these meals during the school. So, and also at the same time abide by the social distancing. We partnered with emergency agencies across the country, as well as providing cooked from scratch, frozen, refrigerated, shelf stable, single packs, family packs to food insecure and underserved communities and homeless shelters and quarantine zones. With the school closing throughout the nation, we served approximately about 100,000 meals per day in about 900 states who otherwise would go hungry. To date, we have served over 14 million meals to students throughout the pandemic and during school closures. It's really important for us to give back to the community, and I feel like it teaches people compassion and understanding. For many children, the school meals is the only meal that they're able to eat. So these children, despite their struggles, want to learn and succeed more than anything. So it's important for us to assist with programs such as the backpack program to provide them with nutritious and easy meals to get them through the weekend. It helps boost their fuel and helps their learning and can keep them more focused. I am committed because I believe that every child deserves a great meal, and to me, it energizes me and my company to look at what we can do today to get more kids fed tomorrow. And the pictures that you're seeing is at Welsh School, and the community engagement person, Miss Kiki, was super excited and helpful, and all the kids got really enthusiastic and they loved it, and it was something that they looked forward to each month when that program came into the school.
Thank you, Kim, and thank you for the support, of course. In addition to working with local corporations, collaborating with partners in the region is critical to Philabundance's success. And so next I'd like to welcome Erin and Lauren with the school district to kind of talk about how we partner and overlap in fighting child hunger.
Great, thank you for having us. My name is Erin Cassar, and I'm a Senior Research Associate at the Office of Research and Evaluation here at the school district. And one of the things that my office does is conduct a district-wide survey every spring of our students, teachers, principals, and parents and guardians. And we were able to, a few years ago, we were able to add several questions about food insecurity onto our district-wide survey. The reason we wanted to do that is because we wanted to make sure that the partnerships that we have in the district and the SNAP-Ed funded work around, especially around food access, were meeting the needs of our schools. So we wanted to be able to assess what schools have the greatest need. So we have several questions. The parent question looks at food insecurity. About 23% of our parents and guardians in 2018-19 responded to this question, and about indicating that 12% of those families were in need, had food insecurity needs. We think this is an underestimate because again, the response rate for the parents is pretty low compared to the other groups. So we do think this is an underestimate. However, it still gives us really vital information by school about what schools have the highest need. In addition, about 67% of our teachers across the district responded to this question: how much of a challenge to student learning is student hunger? How much of a challenge is it? And 19% said it is a slight, moderate, or great challenge to student learning. Similarly, about 32% of principals said student food insecurity was a challenge to learning. So a lot of our educators are seeing this as a major challenge to learning in the school district. So this is the reason this is really important to us here at the school district is because we know that healthy students are better learners. We know that from the literature, we know that from anecdotal stories that we hear from our educators. And the literature says that fruit and vegetable consumption, breakfast consumption, sufficient food intake overall, and physical activity are strongly associated with increased grades and test scores, better cognitive performance, higher attendance, and improved classroom behavior. So a lot of the work that Lauren and her team do with the community partners that she works with and that I work with in the Office of Research and Evaluation is to make sure that we're meeting our students' needs in order to make sure that they can get the best education. I'm going to turn it over to Lauren to talk about how we work with our community partners.
Hi, my name's Lauren Nocito, and I'm the Director of Nutrition Education and the Eat Right Philly program at the school district. So our nutrition education department really thrives on partnerships. My role and our 20-person team is funded federally through SNAP-Ed. So SNAP-Ed is, if you're unfamiliar with it, is the educational arm of SNAP, or previously known food stamp benefits. So our mission really is to provide nutrition education both to students and families. We also support a healthy school environment. And then what we're talking about here today is really working with partners to address some of the challenges like food insecurity of our students and families that we see. So in the school district of Philadelphia, our program, our SNAP-Ed funded program is called Eat Right Philly. You may have heard of us. And we work with a number of community partners, including Philabundance. This slide here really shows a depiction of some of the healthy food access work that we've been putting in place over the last several years. And at the end, kind of at the end of last school year, the school year ended abruptly, but we had over 50 of our 215 school district schools with some form of healthy food access work happening. So as you can see on this map of Philadelphia, it was spread out. It targeted a lot of the high poverty neighborhoods, but we had pop-up produce stands at these sites. Parents could purchase low cost fruits and vegetables. And then we also had food pantries, the backpack program, and fresh produce distribution where families could get free food and free fresh produce. So this is what we're looking at here. The backpack program was a huge success in a lot of schools that had high needs. Erin did a particular evaluation on that, so she can talk through some of the findings from that too as well.
Thanks, Lauren. Yeah, so my team, last year we conducted a survey of about 43 kindergarten through third grade families to assess how they were feeling about the backpack program and their satisfaction with it, as well as looking at the feasibility of doing the backpack programs in schools, what made it more or less feasible. And we found that overwhelmingly, program staff and school staff as well as parents were overwhelmingly satisfied with the program. They perceived it as meeting a need in the school community, and that increased their motivation to coordinate the program. So they were really wanting to make sure that their families and their students had enough to eat through this program. We also found that, in addition, that almost 93% of the parent respondents said that the program made them feel more secure and connected to the school and supported by the school. 88% of the responding parents and guardians sometimes or often shared the bag of food with their family, and 74% wanted the bag sent home more often. 77% felt the backpack sometimes helped their child's dietary needs as opposed to often. So overwhelmingly, this was a successful program in our schools, and we very much want to keep it going and even expand it as possible.
Thank you, Erin. And now we'll open up to some questions. So feel free to, I'll give everyone a couple minutes to submit your questions. And
So we have a question already that I think Hillary could start on, which is about, do children bring backpacks to you to be refilled? Given that these children often do not have food available at home, do you counsel them that the food needs to last for 4 days?
Sure. So part of that implementation happens at the partner level, at the school level, where we work with our nutrition educators and our site coordinators who really have that one-to-one communication with the students and the communities at the school. The kids do use their own backpacks, and a backpack is provided if needed for them to put the food bag in. It's 4 different meal bags that come inside of a large Ziploc bag for easy distribution, and those bags are then placed into the kids' backpack. And then the nutrition educators do work with those kids and families to provide some supplemental recipe ideas, how to use the food, what you can add to the meal bag to make it go a little longer or feel a little bit fuller. You can add any kind of fresh or canned protein or produce to the meals to make it more substantial.
Thank you. I don't know, does anybody want to add anything to that? We have another question, which is about what are the ways that people can help in addition to making financial support? So I guess as a Chief Development Officer, I'll start with that one. And if anybody else would like to add, we always say at Philabundance that we really need funds, food, and friends. So obviously monetary donations are the most helpful to us because we have buying power and we can identify what's needed and move most quickly with those. But in addition to financial support, volunteering either here at Philabundance or with your local food pantry is really can be very helpful, and we can direct you to your local Philabundance member agency to volunteer. You can deliver food, you can pack food. There are all kinds of things that can be done even now. And you can also have a food drive. As Lori mentioned earlier, we just reopened our food drives to the public, and we need food. So we are working to do that as well. I don't know, Lori or Hillary, if you'd like to add anything to that.
Yeah, I think that what you said is exactly right. That obviously, in addition to funding, people can donate food that we'll be able to then distribute out to folks as well. With respect to friends, and I think which panelist mentioned this, talked about the SNAP program, the Supplemental Nutrition Assistance Program, formerly known as food stamps. And on this conversation, we talked about with respect to education and kids. But one of the things you're likely seeing and hearing if you're paying attention to food insecurity issues across the country is that there's been a push to increase the amount that families have for SNAP. And so for those who are interested in advocacy, we've partnered with folks across the region and across the country through Feeding America to say, particularly at this time of need, how do we ensure that families have a little bit extra money, quote unquote money, through the food stamps or SNAP program to be able to choose the food that they're offering to their families. And so in addition to providing food through food drives, providing funding, we definitely encourage you to be advocates with us in ensuring that the families have the resources that they need.
Great, thank you. We have 2 other questions, which is one, why is it that parents think that backpacks don't often meet their dietary needs? As opposed to, I think the survey said sometimes, so.
Yeah, so what we heard overwhelmingly in this survey, as well as in the interviews that we conducted, was that parents really wanted and needed more food. So it could be that they answered that way because they actually just needed more food to fully meet the dietary needs. And in particular, they wanted more fresh fruits and vegetables.
Thank you. And Hillary, you touched on this before, but maybe you could elaborate on how the backpack program is adapting to deal with the increase in virtual schooling this year.
Sure, absolutely. So this year we will, because schools are closed and they have really limited resources to operate as is, we will be distributing the backpack product through our agency network. And then we'll be working with our site coordinators from the school district and the nutrition educators to help communicate where that food will be available to those school communities that were already participating and to anybody else that wants to participate now. So instead of it just being at the Welsh school, we'll hopefully have a pantry that is nearby to that school, and we will then bridge that communication and foster that relationship development to get families to go to that pantry. By doing so, that will also enable the family to receive any other resources and food available at that pantry and make them more aware of the resources that are available to them in their neighborhood.
Thank you. And then similarly, can you talk a little bit about what Philabundance, we had a very Philadelphia-centric presentation today. Can you talk a little bit more about what we're doing to fight hunger in other counties, in the 8 other counties we work in?
Sure. We work really strategically with our regional partners and our agencies throughout the service area. And we have a produce hub that goes to just about each of our counties that distributes large amounts of produce and other food, and that the smaller agencies in those communities then help distribute it out and redistribute the food to the families in those neighborhoods. We work with a variety of partners. We have Bucks County Opportunity Council in Bucks. We work with the Monco Anti-Hunger Network in Montgomery County. We have a Delaware County group that there's a regional partner that kind of serves as that main hub, and we continue to distribute food out through those channels.
How are families chosen to participate in backpack? Can families be referred by partner agencies if the need is identified, or what is the selection process for kids participating in the backpack program?
Sure, great question. So the backpack program is actually an open program to anybody who self-identifies that they have a need for additional food and they're within our service area. So anybody can go to any agency that we serve that will have the food there and say, I want to participate in the backpack program. I need extra help. There's no paperwork that's needed to be filled out to identify that need, and they can just go in and receive food that day and come home.
That's great, and I understand it's an opt-out program, right, as opposed to an opt-in program?
Traditionally, yeah, that's what we called it when we were operating schools. So we were serving the entire school community, and then families would we would send home a flyer and information about the program, and students and families would then be able to fill out the flyer if they didn't want to participate, saying this food isn't for me, or this program isn't for me, or I don't need this. That helped to reduce the paperwork and ensure quality and equity for the whole student community, and made it feel more of a community program.
So thank you. So there's another question, which is about, can families, for this year, because everything is different this year, can families identify a proxy to pick up their backpack if they can't get to the pantry nearest to the school during the pantry's open hours? That's
a great question. I think that we can certainly work with families as needed on a proxy basis. And I think one thing there, though, would be somebody would have to be able to go to the pantry while they're open. But if the family isn't, we can certainly have a proxy. That shouldn't be a problem.
Okay, thank you.
Mm-hmm.
And there's a question about what we're doing in New Jersey, which I assume is fairly similar to what we're doing on the Pennsylvania side of our program too. We work in Burlington, Gloucester, Camden, and Salem counties in New Jersey, and we have some great partners over there. Hillary or Lori, I don't know if you want to elaborate on that.
We really do have great partners over there. We work closely with the Food Bank of South Jersey, who actually implements a backpack program of their own. So they're by and large providing that program to students in those communities. We do have a few, I believe just one school that we've been working with to provide backpack programs over in Camden, as well as produce and other items, dry goods. And they've been doing more of a school pantry model at that particular site.
Thank you. Great. Well, I think we have answered all the questions. Are there anybody else have any questions they would like the panelists to respond to? Okay. All right. I'm just checking because I thought something popped up, but now I can't find it. Okay, thank you very much.
Sarah,
Yep.
a question pop up for the school district team.
Yes, there it is. Thank you. What about school lunches? Will they be served at all this year?
Yeah, so I can answer that one. So our Division of Food Services team is working really hard right now. Through the spring, they set up distribution sites at 42, I believe, school locations and buildings that would serve meals. They are expanding that for the fall. So they are in the process of getting school sites. So it will be at a school building. There'll be a total of 65 school buildings that will have school meal distributions happening on Thursdays. So it'll be, the family would be able to pick up 5 frozen breakfasts and 5 frozen lunches for the week. So it's a one-day distribution time. And I'm glad somebody brought this up, because one of our challenges that the school district is facing right now, and here's where voice and advocacy can lend a hand, is that right now the USDA has not issued waivers to allow open distribution. So when COVID hit, and also through the summer months, there's been open food distribution for all kids under 18 years of age. So if that waiver is not extended as of September 1st, the school district and the food service department is actually forced to have to take IDs from only district students and can only serve meals to district students. So they're worried that this is going to be super confusing to families, to students, to parents, to caregivers. And we're really hoping that the waiver is extended through the USDA so that all children, parochial, private school, any student, non-district student that shows up to these sites can get food if they have a need. So that's one of the challenges that we're facing, and a little bit in a panic mode at the school district to make sure that we're serving students fairly.
So Lauren, is there, in terms of advocacy, what can the ordinary individual do, if anything, to raise a voice about this?
You know what, we can, I guess maybe in the afternotes, we can set up some information and some links to provide that for people to help out with that.
That would be great. And then I'd also like to use this as a segue to say that in the Philabundance quarterly newsletter known as The Food, a couple issues ago, we started implementing an advocacy corner to just keep people up to date on things that are going around with SNAP legislation that Lori mentioned, and other benefits and support, so that people can just be more aware of what's going on.
Yeah, and if I could just jump in, I'm glad, Lauren, that you brought up the need for waivers. Definitely through the beginning of COVID, that's something that was incredibly important for us. So it was no longer was there a requirement that people showed up with ID, income eligibility. We're able to ensure that people who needed food could get it. And we have been talking to elected officials as an organization, and have called on other people to do so. When you think about it, like, people already are in such a need. People in some cases are here on these food lines because they've recently lost a job because of COVID. And so to have that added burden of having to show ID or have prove that you've lost your job, it just adds to, I think, the indignity of this. And so whatever we can do to ensure that people can easily access food in need, whether for school students that you're talking about, or definitely what we're seeing across the agency network, would really be appreciated. So yes, Sara, let's make sure folks do have information about how to get information should they want to be advocates and support us in that particular way.
Absolutely. Thank you. I believe we are at the end of our questions now. So I want to thank everybody for joining us this afternoon to learn more about the issue of child hunger, which is just another dimension of our work here at Philabundance. And once again, COVID is asking us to change our business model to adapt to school closures and the impact of more parents being out of work. Thanks to our remarkable staff like Hillary, we can make these changes thoughtfully and with limited disruption. And we are very grateful to Kim, Erin, and Lauren, who gave so generously of their time and expertise today. Our work to feed hungry children and their families does not happen without you and your continued financial support. And as we move into the end of summer and into the holiday season, we are really optimistic that your generosity and that of other Philadelphians will continue and provide the financial resources we anticipate needing to keep everybody fed. So stay well, everyone, and may your plates always be full. Thank you.